Hello, my name is Rachel. Welcome to Cincinnati Children's Hospital Medical Center. This video will talk about basic information about what it is like to have surgery at our hospital. On the tour, we will show you some of the places that you may go and what to expect the day of your surgery. When you arrive at the hospital, you will check in at the welcome desk. Then you will take the elevator upstairs to the surgery area and go to the registration desk. The staff will ask some questions and put information into a computer while you wait quietly. The staff at the desk will then put a wristband around your wrist or ankle. This wristband has your name and other information on it. It is important to leave this band on so that the hospital staff will know your important information. Your family may need to sit at a desk and answer some more questions. Soon it will be time to come back into the same day surgery getting ready area. Once inside, your family will give the staff important information and someone will meet you to begin helping you get ready for surgery. First, they will check your height and weight. Next, you go to a room we call the getting ready room. The caregivers that come with you can come back too. There are a lot of people for you to meet in this room. Their job is to help you get ready for surgery. In the getting ready room, the nurse or patient care attendant will listen to your heart and lungs with the stethoscope. You will need to take deep breaths in and out. Next, the nurse will measure your temperature. The nurse will use a thermometer that goes across your forehead and behind your ear. Some boys and girls say that it tickles. When there is a beep sound, then this job is all done. The nurse will put the pulse ox on your finger. The pulse ox is sometimes called a finger light. It looks and feels like a Band-Aid and glows red. It tells the nurse how well you are breathing. It has to stay on until the nurse says it is time to take it off. Then we will check your blood pressure with the blood pressure cuff. Sometimes this is called an arm squeeze. It will wrap around your arm and squeeze it just a little bit. If you hold very still, this job will be finished quickly. Sometimes patients like to bring something from home, like a stuffed animal or a pillow or a blanket, to keep with them during their visit. The nurse will put a sticker on the item to be sure it does not get lost during your visit. Next, you will change into hospital pajamas. If you are feeling nervous or have questions about being at the hospital, ask to talk to a child life specialist. A child life specialist's job is to help you understand what's going on and make your hospital visit easier. When it is time for your surgery, you'll go for a ride on your bed with wheels, called a stretcher. The stretcher can sit up like a chair. A caregiver can also come along. You will ride on the bed to go to the place where your surgery will happen. This room is also called the operating room. The next room you see is the induction room or sleepier room. Sometimes boys and girls go to this room and sometimes they go right into the operating room. In the sleepier room, there is a big machine and there will be people in the room with green clothes and hats that cover their hair. They wear these things so they don't share any germs with you. They are nice and friendly and will be in the room during your surgery. There will be a soft mask that will give you sleepy air or anesthesia. You'll get to choose what the sleepy air will smell like. The smell is sprayed into the soft mask or tubing. The doctor will gently hold the soft mask with the sleepy air over your nose and mouth. You can stay on the bed or ask to sit on a grown-up's lap while you are smelling the sleepy air. You will take deep breaths until you fall asleep. Sometimes for older patients, it is decided that they will need to have anesthesia medicine through an IV to go to sleep. An IV is a catheter or a tiny straw that goes into your vein in your hand or arm. The IV may be done in the getting ready room or back in the operating room. An anesthesia staff member will talk to you and your caregivers to make an anesthesia plan. If you have questions or are feeling nervous, ask to talk to your child life specialist. The next room is called the operating room. This is where you will have your surgery. Going to sleep for surgery is different from going to sleep at night. When sleeping at night, if there is a loud noise or if someone gently shakes you, most people would wake up. However, when you fall asleep by breathing the sleepy air or by getting anesthesia medicine through an IV, you will not be able to see, hear, smell, or feel anything during your surgery. When the surgery is over, the doctor will stop the sleepy medicine and you will slowly wake up. The PACU, also known as the post-anesthesia care unit or recovery room, is where you will wake up after your surgery. This room has curtains for walls, so you may hear other children waking up who have also just had surgery. There are 2 chairs in the recovery room for your caregivers who came with you. We will tell them when your surgery is done so they can be there while you wake up or soon after you wake up. A nurse will be with you the whole time. In the PACU or recovery room, everyone has their own nurse. While you are waking up, the blood pressure cuff will squeeze your arm every once in a while. The pulse ox or finger light will be back on one of your fingers. These will plug into monitors so the nurse can see how your body is doing. There will also be a mask like the one that helped you fall asleep. Instead of sleepy air, this mask will be giving you extra air to help your body wake up just a little faster. Sometimes the mask is lying on the bed and sometimes it is lying on your chest. In the recovery room, you will have 2 jobs. The first job is to tell either your caregivers or the nurse if anything hurts so that they can give you medicine to help. The second job is to have something to drink. It is important to drink because it has been a long time since your body has had anything to eat or drink. Remember that tiny straw called an IV? When you wake up, you may have one in your hand or arm. The IV helps give your body medicine and something to drink. There will be tape on it, and the tape might wrap around a small pillow to help your hand stay still. The IV does not hurt, but it feels a little different. Once you are awake and have had something to drink, you will either go home or go to a room in the hospital to spend the night. When you go home after surgery, the nurse will take out your IV. Some kids say it feels like a Band-Aid being taken off. The nurse will gently slide out the tiny straw or catheter and place a Band-Aid on that spot. The nurse will tell you when you can put your own clothes back on before you leave the hospital to go home. You will get to ride out to your car in a wheelchair or car cart. If the doctor decides that you need to spend the night or for a few days, we will have a room just for you to stay in. It will have its own bathroom. There is also a couch that turns into a bed so your caregiver can stay in the room. A nurse or child life specialist can bring fun things to do, such as toys, board games, movies, and crafts. There is an activity center where you can go to play with other children and a teen room for patients who are 12 and older. If you had an IV or tiny straw, the nurse will then gently slide out the straw and place a Band-Aid on that spot before you go home. We hope that this tour information has been helpful. If you are interested in taking an in-person tour or have further questions about your visit, please contact our same-day surgery child life staff by calling the number listed at the end of this video. The staff at Cincinnati Children's Hospital Medical Center look forward to seeing you and helping you with your visit.